Hello students, welcome to Vision Pharmacy. In this video, we are going to study about classification of dosage form. Along with classification of dosage form, we are also going to focus on some important definitions which are associated with the topic. Also, we are going to study about need for dosage form. So before we begin, I request you to please like, share and subscribe my YouTube channel. Now, let's begin the first definition, that is what is drug. According to definition of Drug and Cosmetic Act 1940, drug includes all medicines for internal or external use of human being or animal and all substances intended to be used for or in the diagnosis, treatment, mitigation or prevention of any disease or disorder in human being or animals, including preparations applied on human body for the purpose of repelling insects like mosquito. Then the definition also includes any substance other than food intended to affect the structure or any function of human body or intended to be used for the destruction of vermin or insects which cause disease in human being or animal, as may be specified from time to time by the central government by notification in official gazette. Then all substances intended for use as component of a drug, including empty gelatin capsule and such device intended for internal or external use in diagnosis, treatment, mitigation or prevention of disease or disorder in human being or animal, as may be specified from time to time by central government by notification in official gazette after consultation with the board. So, in short, we can say that a drug is nothing but a substance which can be used either for external or internal use, right? Either in human being or animal for the purpose of either treatment, diagnosis, treatment, mitigation. Mitigation is nothing but making it less severe if we cannot cure, or prevention of any disease or disorder. Okay. Also, if anything that is applied externally, like that we use odomos and all, even that can be categorized as drug which helps in repelling the insects or mosquitoes. Then the definition also includes any substance, anything what we take other than food, which intends to change or which intends to affect the structure or any functioning of human body can be said to be drug. Our drug includes even empty gelatin capsule, that is any of the component which is used for preparing of a drug, that can be also categorized as drug, and any of the substance that a government may specify in official gadget are all categorized as drug. Then the next definition, that is pharmaceutical excipients. So pharmaceutical excipients are referred to pharmaceutical ingredients that are generally inactive or non-medical substances intended to include in drug to serve a specific pharmaceutical purpose during manufacturing, storage or use. Okay, so pharmaceutical excipients can be defined as substance other than that of active pharmaceutical ingredient used in formulation of pharmaceutical product. Now, whenever we are formulating any dosage form, along with active ingredient, we also require various of the ingredients like that of bulking agent, disintegrants, stabilizers, solvents, lubricants, binders, preservatives, etc. So, all this other than your active ingredients, they are said to be pharmaceutical excipients. Then, this is used to ensure that the drug product is acceptable to the regulatory authorities and patients in terms of manufacturability, appearance and performance. Then the next one, that is dosage form. So now you have seen what is drug, right? What is excipients, then coming to dosage form. So dosage form, the term dosage form refers to pharmaceutical preparations or formulations in which specific mixture of drug substance, that is active pharmaceutical ingredient, and inactive component, that is excipients, are presented in a particular configuration to facilitate easy and accurate administration and delivery of active drug substance. So this is our dosage form. Then let's talk about what is the need for dosage form. So apart from ensuring safety and convenience delivery of a required dosage of drug substance to the site of action, dosage form are needed to follow additional reasons, like that of the first one, to achieve rapid onset of action following drug delivery, right? Like that of parenteral dosage forms are there, right? Inhalation, respiratory dosage forms are there. Here you can achieve a rapid onset of action. Then the next one is to mask the unpleasant taste or offensive odor of the drug substance, like that in a capsule. Then test masked suspension, coated tablets, etc. Then the next one is to achieve improved bioavailability, then modified disposition as well as drug targeting, example nanosuspensions. Next one is to provide drugs that are stable, effective and safe for consumption under specific or specified suitable storage conditions, like that of powder for reconstitution. Then the next one is to protect the drug molecule from the destructive influence of gastric juices following the oral administration of dosage form. For that purpose, what we can do is we can prepare enteric coated tablets, right? Then the next one is to provide drug product that bypass the first pass metabolism, example your injections and topical dosage forms. Then to provide drug with predetermined rate and prolonged therapeutic effect over the extended period of time, example modified release tablets, capsules and suspension. The next one is to provide drug products that bind to specific physiological site of action. For example, we have targeted release capsules, tablets, etc. Then next one is to provide useful dosage form for administering poorly water soluble or insoluble drug in appropriate vehicle, example suspension. The next one, that is to provide a sterile, clear and particulate free liquid dosage form for substances. Example, we have injections, eye drops, etc. So these are all the various advantages or the various needs for formulation of dosage form. Then coming to next one, that is classification of dosage form. So our dosage forms can be classified on four different categories. The first one is site of application, then the next one is use, route of administration, and the last one is a physical state of your dosage form. So let's begin one by one. The first one, site of application. So depending upon what type of formulation are applied at what site, it can be categorized on site of application. So the first one, skin. So for skin, we have ointments, cream, lotions, liniments, etc. Then second one is eye. For eye, we have eye drops, eye ointment, eye cream, etc. Then tooth, we have toothpaste, tooth powder, hand creams, lotions, hand washings, etc. Then for foot, we have creams, ointments, dusting powder. For hair, we have hair creams, hair lotions, hair gels, shampoos, then hair fixing. Then for nasal, we have solution, spray, inhalations, etc. Then the second classification is based on use. So the first one is for internal use. So all preparations except external. Okay. So all the preparations that can be taken internally are termed as internal formulations. Then the next one is external. So external includes like that of ointments, creams, lotions, powders, solutions, liniments, paste, hair dye, hair colors, etc. So the preparations which are to be applied externally. Okay. So this is again the second classification based on use, that is internal as well as external. Then the next one, that is the classification including which is based on route of administration, and the last one based on physical form of the dosage form. So in method or route of administration, it can be categorized like that of topical dosage form, parenteral dosage form, vaginal dosage form, nasal dosage form, oral dosage form, rectal dosage form, respiratory or inhaled dosage form, then ophthalmic dosage form and otic dosage form. Whereas for physical form, it depends on our dosage form. So it can be categorized like that of solid dosage forms, semi-solid dosage forms, liquid dosage form, and gaseous dosage form. So now let us discuss a classification of dosage form based on route or method of administration in detail. So route of administration of drug product is usually determined by the physicochemical characteristics of the drug molecule. Okay, so dosage forms are classified based on either route of administration into the first one, that is you can see here oral dosage form. So oral dosage form comprise of pharmaceutical formulations that are to be taken orally for a systemic effect. They are absorbed through the various epithelial and mucosa of the gastrointestinal tract. Okay, then the various drugs that are taken by this route include tablets, capsules, suspensions, lozenges, pills, granules, powder, emulsions, etc. Then the next one, that is tropical dosage form, you can see here in the image. So in this include various molecules that are in suitable solid bases like that of powders and aerosols. Also sometimes semi-solid bases like that of ointment, cream, foam, gels, or it may be in liquid forms like in solution, suspension. Okay. So of solid in aqueous solution or emulsions which possess either hydrophobic or hydrophilic properties. These drugs are applied on the skin or other tropical surfaces such as your ear, then eye, nose, mainly for local action. Then systemic drug delivery can be achieved by using tropical preparations like that of we have transdermal patches through absorption is I mean though absorption is achieved through tropical application. Then the next image what you can see here is for is of rectal dosage form. So these are I mean rectal dosage forms can be solution, suppositories or emulsion administered rectally for local effect rather than systemic effect. Then this formulation can also be used for delivering drug that are inactivated by gastrointestinal fluid when administered orally. And the next here you can see is parental dosage form. They are usually sterile, particulate free, and non-pyrogenic solutions or suspensions of a drug in water or other suitable what we can call it as physiological acceptable vehicle, which are injected into the body using syringe and needle infusion sets, etc. Then the next image is of respiratory or inhaled dosage form. So this type of dosage form is where the drugs are administered in gaseous or aerosols mist or ultrafine solid particulars from I mean ultrafine solid particles form into the lungs. The classes of dosage form are mainly from direct treatment and the management of the respiratory disease. So examples of respiratory dosage form include your nebulizers, then powder aerosol and pressurized meter dose aerosols. Then the next one, that is vaginal dosage form. So these drugs are used generally intended to be used in vaginal cavity for either contraception or induction of labor, treatment of vaginal infections, or any other local symptoms. Then commonly used vaginal dosage form include creams, tablets, vaginal gels, pessaries, suppositories, foams, ointments, inserts, etc. So other products like vaginal rings, vaginal films, etc. are also available. Then the next one, here you can see ophthalmic dosage form. So they are principally sterile solutions, ointments or suspensions essentially free from particles or substances that might irritate the eye. They are meant to be generally applied on the eyelid or placed in the pocket between the eyelid and the eyeball. Ophthalmic dosage forms are commonly used to treat local infections or local ocular disorders, or that is infections or inflammations. The next one, what we have is nasal dosage form. So nasal formulations are non-sterile, aqueous based system that are instilled into or sprayed onto the nasal cavity from a dropper or from a plastic squeeze bottles. They are predominantly employed for treatment of local disorders. Then nasal preparations, when absorbed from the nasal mucosa, systemic effect can be achieved. Then the next one what we have is otic dosage forms. So these are again non-sterile aqueous solutions or solution prepared with glycerin or other solvent and dispersing agent which are instilled into the ear canal for treatment of local disorders. So this is classification based on a route of administration. Then coming to next one, that is depending upon their physical states. In physical state, the very popular, that is solid dosage form. So this comprise drug products that are having a definite shape and volume. They constitute approximately 90% of all dosage form clinically used to provide a systemic administration of therapeutic agents. This class is broadly comprises our tablets, capsules, others including like that of powders, granules, etc. Then the next one what we have is semi-solid dosage form. So these preparations applied on skin or the mucous membrane to achieve local or systemic effect. Examples ointments, creams, then paste, gels, etc. Semi-solid dosage forms have many characteristics in common, like that of consistency, then presentation, then preservation is required, and also a route of administration generally is tropical. Then the next what you can see here is liquid dosage form. So this include drug products administered into the form of solutions, suspensions, then emulsions, etc. Liquid dosage forms can be sterile or non-sterile depending upon route of administration. Then the next image what you can see is of gaseous dosage form. So this class comprise of air drug products that are packed under pressure in a holder with a restricted conveyance valve framework. The gas inside contains restoratively a dynamic medicament that are released upon activation of the appropriate valve system. Examples we have aerosols, nebulizers, spray, inhalers, etc. So this is the classification of dosage form. I hope you understood the classification. Thank you.